Hi, I'm George and this is John. We're both from the Veterans Wellbeing Centre at Hornsby. We're here today to produce an assistance video for veterans on managing your medicines. We'll be joined later on today at the Hornsby Heights Pharmacy with a young lady called Alex Torrens, who is a flight lieutenant in the RAF Reserves and also a pharmacist. She is the owner-operator of the Hornsby Heights Pharmacy and will take us through all the different steps in managing your medicines. We're looking forward to meeting her within the next couple of hours. So thank you. Good morning, my name is George Main. I'm from the Veterans Wellbeing Centre here at Hornsby. I'm with Alex Torrens today, who is the pharmacist and owner of the Hornsby Heights Pharmacy and is also a member of the RAF Reserve. You're a flight lieutenant pharmacist.
Yes.
With the RAF Reserve. We're here today to discuss medications for veterans and the many issues faced by veterans trying to obtain and understand their medications. We actually have a 10-point checklist that we're going to talk about together and discuss some of the issues. So welcome.
Thanks for having me, George.
Okay. Medications, I guess in the service you just go to your normal RAP or doctor and you get your pills and you walk away, you don't think much of them. But there's a greater issue for discharging veterans leaving the services to go in to a pharmacy and to start talking about medication. So let's start going through what we consider the 10 checkpoints that we need to consider about medications and use your advice and your experience here as a veteran as well in the RAF and also a very experienced pharmacist.
Yes.
So at the moment, the first check thing is to know your medicines. So can you explain about knowing the names? Things are very complicated, some of these medicine names.
Yes, they can be. And you make a good point there, George, about when people discharge from the Defence Force, whether it be recently or a long time ago, sometimes they're used to just going into their pharmacy there and having that all sorted. So when you leave, it's important to take ownership of that and really get an understanding of what it is you're taking. And so, as you said, the first step in that is know those medicines. What are the names of them? That can be a bit tricky because there's often a brand name and then a actual drug name for that. So my tip would be to try and learn the actual drug name of your medication because that way it doesn't matter what brand you're given, you know what it is that you're taking.
Well, that's a good point because quite often when you go to the pharmacy, you'll be offered the brand or a chemist's own or a pharmacy own. Are they the same medications?
Yeah, so for pharmacies to be able to substitute or give you a different brand, yes, they do need to be identical. And that's why it's important if you can know what the actual drug name is rather than what brand you may have had. It's less confusing for you.
Right.
So some of the things that a pharmacist, and if you get to know your local pharmacy, can help you with is developing an understanding of that. We can do something called a meds check, which is where we sit with you in the pharmacy, go through your list of medications, talk about what you're taking, the names of them, what they're for, and help you prepare a list of what they all are.
I think that's a great idea because I think a lot of veterans, especially contemporary veterans, might have been in Afghanistan or Iraq and have recently discharged, might have several medications, probably 4 or 5, some to help with psychiatric problems, some to with medical issues. And I guess you've got to have a better understanding what the drug does for you as well, and what you can and cannot have with it.
That's right. The more medications that you're taking, the greater the potential for them to interact either with each other or, as you mentioned, with possibly things that you are going to buy over the counter. So that's an important consideration if you just have a cold or something like that.
Yep.
When you come into the pharmacy seeking medication for that, make sure you chat to your pharmacist about what medicines you are taking. And the list can be helpful because if you've got that in your pocket, you can show the pharmacist, this is what I'm taking, what can I take for my cold? Or
agreed, because
like
some of the medications would be quite strong medications, opiates and things like that, I would imagine some of our veterans might be on. Alex, I guess one of the most important things is taking the medication as prescribed. I guess you must keep an eye on the medication dosages, and it could be paying attention to what the script says or the packet says, because I think that's most important, because if you start taking too many or at the wrong time. So what would your advice be for that?
Yeah, definitely. Medications will only work for you if you take them and if you take them correctly. So there can obviously be safety issues in taking too much of a medication, and if you don't take enough, then sometimes that it won't work because the dose will be ineffective. So the important point there is to make sure that you take the medicine as it's been prescribed by the doctor. And if you have any questions about that, if you're not sure of what you're supposed to take, to just double check that.
Okay, well, if I was taking my medication and I'm starting to have some issues, now I know that most of the medication packets have a little warning labels inside, or what the side effects are basically. Now, if I'm having some issues, I could go back to my pharmacist really and say, look, this particular tablet I'm taking for this is giving me crazy head or something, or I'm feeling crook. What would your advice be then?
Yeah, I would say to definitely get in touch with your pharmacist and or your doctor, because you don't want to be guessing about what you should do. You might think that you want to just keep taking it, but if it's really affecting you badly, you need to seek advice about that.
All right. Would you advise someone to actually stop their medication if they're having serious side issues or side effects from the meds? So if I come in to see you and I'm really having some issues, would you advise me to stop and then contact my doctor straight away, I suppose?
Yeah, that's where I think the advice of your pharmacist is really important, and it's a really individual answer to that question. It would depend what the medication is, it would depend what kind of side effects you're experiencing, and so I would say contact your pharmacist for that advice, because it could be, you're right, if it was very severe, they would say, no, you need to stop that now. Or if it was a less severe side effect, that was something that's to be expected of that medication, they may say, that's okay, that's normal, bear with it, it's only for a day or so. But that's where it's very individualised and something that I would speak to your pharmacist about.
All right, so you're aware of those side effects when you issue these medications to our veterans and that. And there is always some side effects, I suppose, for some of the medication we take. But I guess if you build a rapport up with your pharmacist, then you'd have faith in the pharmacist by going back and saying, look, I've got an issue with so-and-so, I don't feel well, and your advice, as you just stated, would be, well, that's normal, George, that's the type of side effects you get, you'd be right. Or because you have this relationship with your local pharmacist, you would trust that person. You would say, look, stop, George, ring the doctor now.
Yeah. And there's, when you get medication, there's information called Consumers Medicines Information. So that's a printout that the pharmacist can give you. And what we usually try and do is when you get a prescription for the first time, is we give that to you. Sometimes it comes in the box, other times we print it out, and we can go through that with you to try and give you some idea of things that you might expect. And sometimes there's little tips around how you can minimise that. So it could be this thing gives you a bit of an upset tummy. If you take it with some food, the chances of that are reduced. So that's why it's worth having that conversation before. And then when you get home, and if you do take it, you are having a problem, give your pharmacist a call.
Good idea. Good advice. All right. I guess keeping a list of your current medicines also is pretty good. I find it hard to keep a list, so I tend to leave all my scripts with my pharmacist. Is that a good idea, or should I keep them at home? I guess when I leave them at home, I get concerned that I might lose them or I can't find them. But when I go back to my pharmacy, my pharmacist has them all there and they're under control. So is that a good idea? Is that available, or e-scripts or something?
Yeah, there's so many options available these days, and it is a bit of a personal choice. Some people like to keep their prescriptions at home because they can keep track of them.
Yep.
But it's often a good idea to let your pharmacy look after that for you. Most pharmacies have a system where they can keep them on file, let you know when you're about to run out of prescriptions or if you've had your last prescription, and help you to manage that.
Well, I've noticed on some of my pills that I get a little label on there. It tells me how to like take it before lunch, or wait half an hour till after you've eaten, but also reminders when my last repeat's coming up. So I guess that's a good help for controlling your medicine.
Yeah.
Well, what about things like e-scripts? How do they work?
Yes, so this is something that's fairly new to the prescription landscape. And basically it's just an electronic version of a prescription.
Okay.
So that often comes in handy if you are having a telehealth appointment, for example. You might not be actually going into the surgery.
Right, yep.
And so then the doctor can send your e-prescription to your phone or to your email, and you can take that into the pharmacy and they can scan that into their system.
All right. Would I be able to email that from my phone to the pharmacy, or do I have to physically go in with my telephone?
You can. There are ways that you can forward it to the pharmacy, and that can sometimes be helpful if you need someone else to pick up the medication on your behalf.
Good idea,
or perhaps if you are sick and have COVID or something, can't leave the house, and you might want a delivery, you can forward that on to the pharmacy. We can get it ready for you and organise it that way. But there's also a way that you can give your pharmacy permission to view what's called your active script list. So that is where if the doctor has done an electronic prescription for you and it essentially gets sent up into your little healthcare cloud, you can give your pharmacy permission to view that. So then it's like having the virtual filing cabinet there that they can access for you, and that can sometimes be easier.
And that's all through eHealth?
Yeah.
Right.
And again, have a chat to your pharmacy about that, because we can help you set that all up to help you manage it easily.
Because I notice when a lot of veterans get out, they don't have any idea how all these things work, like how eHealth works and how to get registered, because we're just so used to having the military take care of us. So I know when I resigned my commission and left, I went online and you link all your services together like DVA and eHealth, and through my eHealth records I could see how many times I've been to the doctor and what I have done and what medications I was issued with, and I guess that links into now with this new e-scripts.
Yeah, so there's a whole lot more health information that's available electronically now.
Yeah.
But also the paper system is still there. So if that's your preference, that you would still like the paper prescription, you can still ask for that. And either way, your pharmacist can help you manage it.
You know, Alex, another important issue I think is the expiry dates of medicines as well, and keeping old medicines, because I know some of the vets that I have visited, they have a collection of medications. They might be on 5 or 6 different medications, and you go around and you think, well, I wonder how old some of these are, and I don't think they're paying much attention to the date or the use by dates. Now, do the medications come out with use by dates on their boxes, and then what would your advice be for old medicines?
Yeah, so yes, they do. Your medicines will have an expiry date on them, and my advice would be not to use them after that date.
Okay.
There's a couple of reasons for that. Firstly, what it was prescribed for 5 years ago when you first had it might not be relevant to what you have today, and in fact it could be contrary to some of the other things you've now been prescribed. So you don't want it hanging around in case you take it by mistake or just in case. Also, you don't want a whole heap of collection of medicines around in case you've got grandkids or someone over and they get into it. But beyond that, once a medication has expired, we don't know the safety of that. So the company has done studies up until that drug expires, and after that, if you take it, it might actually not be
All right,
safe.
well then, how do I overcome that issue? I mean, I notice on some of the medication packets, the use-by dates are very, very tiny on the box. I mean, is there a facility available from the pharmacist just to come around to your house and check things, or do I bring all my meds into you to have a look at them?
Yeah, well, yes, there is help at hand. So we spoke before about medication reviews inside the pharmacy where we can talk about your medicine.
Yeah.
For more complex cases, there is a thing called a home medicines review, and that's where a pharmacist can actually come out to your house, have a look at all your medicines, have a look at your medicine cabinet, and help you understand what you have and get rid of anything that's out of date. And so we can help you out with that. You need a referral from your GP to organise that.
So I've got to have a referral first.
Yep, for that to happen.
Okay.
But then once that's in place, the pharmacist can come out and help you sort through all of that.
So what do you do with the old medication? You've gone through and found out I've got a half a dozen meds that I don't really need. Will you take them away?
Yes, we will. Yeah. So we'll take them away with us. We have at our pharmacy, and most pharmacies have a special disposal program. Right. It's called the RUM program, Return Unwanted Medicines. So you can bring them back into the pharmacy, or we would collect them from you, bring them in, and they get sent away for safe disposal. Okay,
now here at Hornsby Heights Pharmacy, I hear you have an SMS system or something. How does that work?
Yeah, so we were talking before about keeping on top of your repeats and your medications. So you can keep your medications on file, your prescriptions on file. Yeah. And at our pharmacy, we have an SMS reminder service. So that is where when your tablet is worked out, you should be about running out of that. We will send you a reminder to say, hey, George, your blood pressure tablet is nearly due. Yep. Do you want us to get it ready? And you can send back a yes. We'll get it ready and send you a message when it's good to go.
Okay, another question I have too, because I notice that a lot of veterans that I deal with have, I think they call it polypharmacy, where you have probably over 5 or 6 different medications at one time. What if I wanted to go away on a holiday and I wanted to bulk up on my meds? I mean, am I able to do that if I think I'm going to go away for a 5-week holiday or something and I'm running low? Can I bulk up on my pills, given this new 60-day business on script or something that the government's pushing?
It's all a bit complicated, but yes, there are ways if you were going away that you can get extra medication. So the doctors can write special prescriptions that allow you to get enough medication to see you through for the period of time that you're away. Right. Another thing that I have found people often use when they're travelling is what we call a dosage administration aid. So that's where instead of you having to take 10 different boxes and bottles of all the different pills that you're taking, you get the pharmacy to put them into a special pack where we lay out. So I've got one here to show you. I don't know if you've seen one before.
A Webster pack.
Webster pack, yeah.
What a great idea. Yeah. And I guess that's got my details, my name, everything on there, my medications, and then
when to take it.
When to take it. And that's a good idea, breakfast, lunch. And given I'm on multiple medications as well, I think that's a great idea.
Yeah.
Now, I can travel with that.
You can travel with that because it's all sealed. It's got your name. Yep. It's got a list of all the different medications that you're taking and when.
Yep.
And it's a lot more compact than multiple boxes and bottles.
Of course.
And what I often find, these are used not just for travel, but people who may have trouble remembering what they're supposed to be taking and when, or just for convenience, get these. I often find people start when they're travelling somewhere and think, you know what, that was actually easier. I'll I'll get that all the time.
It's not a bad idea, given, as I said, multiple medications, and as we are getting older, some of us old veterans, to remember whether you've taken your morning pill half an hour before when you should have taken it.
That's right. You can see clearly, oh yes, it's Monday morning breakfast, I've taken that slot.
Right.
And it's a good point to note that veterans are actually entitled to have these paid for. The packing of that. In conjunction, they need to speak to their doctor and you know, get a referral, make sure that's appropriate for them. So, but it's something they could definitely look into.
But all this initiates from the doctor prescribing, the doctor making referrals to the pharmacist to have all this done. You've got to go to the doctor first and work that way. So I guess if you're a gold carder or a white carder, with Veterans Affairs, you'd come through and get this. Now, what about storing these things? I mean, this looks great, but how do I store all my meds and things when I get home?
Yeah.
What's the best place to put them? If I've got a Webster pack, is that okay sitting in the cupboard like that? Or what if I've got individual packets or bottles? What's the best place of storing them?
The rule of thumb with storing your medication is you want to keep it in a cool, dry place. So you don't want to have it in the bathroom cabinet where there's lots of steam and water and things.
Right, because, you know, sorry to interrupt you, but funny enough, I think most people keep the bloody stuff in the bathroom.
In the bathroom, yeah.
Because they're going through their morning ablutions and things, but that's not a good place.
So somewhere a bit drier and cooler. You also don't want to keep it in your car where in summer, you know, it gets up to really hot temperatures because that can affect the medication as well.
All right, well, that's a good point. Now, if I'm running in a Webster pack and I'm going out for the day, I don't really want to take the whole Webster pack with me. So what would your advice be if I've got to have my lunchtime medication?
You can also get little pill boxes.
Yep.
So you might know, I'm going out for lunch. So you could either pop your pills from your Webster pack or even just from your bottles and boxes at home into your little pill box that you can carry in your bag or your pocket.
Because you don't particularly want to be having lunch and
pulling out your big Webster pack, no.
Yeah, okay. All right. Now, when you say in a cool, dry place, does it matter whether they're bottles or whether they're packets? I mean, where you store these things? I mean, should you keep them all together?
You can keep them all together. That's that's probably a good idea. There are some exceptions to that. Sometimes you will have a medication that needs to be refrigerated, for example, and the pharmacist will alert you to that, put a sticker on it, just to remind you to keep it in the fridge. But other than that, it's often a good idea to keep them all together in the one place, and you know that's where you go to get your medicine.
Well, if you're on a reasonable amount of medication, another thought I might have had, if you've got them all in one location, should you tell your partner or your wife or your children where your medication is and what the medication's for? Because, you know, not everybody knows what dad's on or what your husband might be on. So I guess you really should let the family know as well.
Yeah, that's a good point, because sometimes there are situations where you might go to hospital urgently, and if you can't tell the doctor at the hospital what you're taking, if your partner or family knows that, they can definitely help the doctors out. And I would probably also recommend, when you've got your medicines in this location, this list we were talking about before of what you're taking and when, if you keep that updated and you keep a copy of that with your medications, then if anyone ever needs to know quickly what it is you're taking, you can go to that list and give that information.
Okay, because that's the last thing you think about when you have a turn or you get ill and you have to be rushed off to hospital. Is it advisable to take your medication with you to the hospital or just the list? Because when you get into hospital, they've obviously got to do whatever they're going to do to save your life or whatever.
Yeah.
Would you take your Webster pack with you?
Look, if you can, you could. It's really useful in that it has got the list up the top.
Yep.
But really it's the information they need. So if you didn't have the actual medication, if you had that list, then that would be what they need.
Because I would imagine when you go into hospital, the hospital would want to issue your meds from their pharmacy, not necessarily use your pills. Yeah. Okay, that sounds great. Now, I had one other question before we move on to the next subject, but from what you're saying to me, I think really if you could do it, and you build up a good rapport with your pharmacist, would be to kind of stay with one pharmacy, I should say. They're not called chemists, they're called pharmacies. Us old folk tend to call them chemist shops, but if you have this relationship, I guess it would be best to stay with one pharmacy. Can you explain something about like the PBS? I'm not sure how that works, but I think that only works if you deal with one pharmacy.
Yeah, so I'd agree with you, George. I think that is very valuable if you can do it, to build a relationship with one pharmacy.
Yeah.
There's a couple of reasons for that. One, as we've spoken about, the pharmacist having an understanding of what it is you're taking. You can build that confidence in their knowledge and that relationship with them. And they can let you know then if something that you've selected from the shelf may interact or be a problem with your medication. With regards to the safety net scheme or the PBS, there's also considerations there. So there is a scheme called the safety net, which is essentially when you've had a certain number of prescriptions in a calendar year, from the time you reach that threshold until the end of December, your medicines are then essentially free or at a reduced rate, depending on your situation. Now, if you are going to the one pharmacy, when you hit that threshold, they will know that, they'll see that, and they'll automatically issue that safety net benefit to you. If you've gone to different pharmacies, that responsibility of knowing when you hit that is up to you. So you would have to keep a track of how many prescriptions you've had. So you're right, it would be easier if they were all in one place because that would automatically tick over.
So basically, the pharmacies aren't all linked electronically to cover the PBS, which seems a bit unusual in today's high tech. But if I'm going to different pharmacies, I've got to keep a record of all my drugs and all my expenses, which seems a bit silly given I'm getting in my 70s now. So if I'm dealing with one pharmacy that I'm happy with, like Hornsby Heights Pharmacy, where I have a veteran who's a pharmacist as well, who is aware of the veteran issues and medications, you're pretty much a one-stop shop for all the things I really need to do.
It does make it easier, as you said. It's not impossible. You can go to different pharmacies, but you would need to keep a record of how many prescriptions you've had and then bring that to the attention of the pharmacy when you're getting close to that threshold. But if you're going to the one pharmacy, they will do that for you.
That's excellent. I don't think a lot of veterans realise what services are available from a pharmacy, really. Okay, Alex, I guess coming towards the end of our discussion about medication, there's a couple of things. I know there's a PBS, which is the Pharmaceutical Benefits Safety Net, but also isn't there something for veterans as well who have gold cards and or white cards for their medication? Isn't there another list of items and things?
Yes, that's right. So there is a REPAT pharmaceutical benefit scheme, and there are items listed on that aren't available to the general population, so they're specific for REPAT. So that's something that, you know, if you have a particular condition, that the doctor can prescribe you things that could be of benefit to you.
All right. Well, just to jump in there, sorry. So when I come to see my pharmacist, I'd have to identify that I have a gold card or a white card, or I think there's an orange card now as well. So that initially would entitle me to some benefit as well on my scripts. So
yes, that's right. So when you first go into your pharmacy, make sure you present that gold card or white card to the pharmacy. They can keep a record of that, and that will ensure that you get your prescriptions at the concessional rate.
All right, now what about over-the-counter medications? Now I know I take a small tablet of a morning, which is, I never pronounce the name of it. It has potassium in it, rather than taking an anti-arthritic tablet, but that's just from like your stock at the back here. Is there an issue with that as well? Because your pharmacist would have to know what meds you're on, and then if you're taking over-the-counter stuff.
Yes, and that is a bit of a misconception. Sometimes people think just because I buy it over the counter, it won't interact. So definitely make sure, even when you're purchasing over-the-counter medicines, that you let your pharmacist know what it is you're taking.
Okay. I guess winding up now, I think we've covered most of the items that I can think about for a veteran, but I guess we need to read all your medications, build up a rapport with your pharmacist, someone like you at Hornsby Heights Pharmacy, where you've got someone taking care of you the whole time. So I think that's really the way to go.
Yeah, I would agree. I think just get to know your community pharmacist, and there's help out there for people to help them manage their medication.
Okay. Well, I'd like to thank you very much for being part of our video today, and I hope this is some assistance. Later on at the back of the video, you'll see contact details on helplines and help numbers and that to go to. So thank you very much, Alex, here at Hornsby Heights Pharmacy, and I wish you all the best with your career with the RAF Reserve as well as a pharmacist. So thank you.
Thank you.